Hey everyone, it's Dr. Miller at Liberty Pet Hospital. Today's topic is going to be introducing your dog to your new baby. One of the first questions I ask clients is if their dog has ever seen an infant or a child before. If so, and things have gone well, meaning your dog appears calm, no signs of distress, that's great. If your dog has never seen a child before, we've got some homework to do before your baby arrives. However, if your dog has interacted with children and you perceive it as being stressful, or the dog's felt threatened and shown signs of aggression, biting, snapping, lunging, things like that, then please give us a call to schedule a consultation. We may also refer you to the veterinarians at Ohio State Behavior. They are boarded in behavior, and think of them as doggy psychiatrists, so they can help one level beyond, especially if there's aggression in the home and human safety is a major concern. But this is going to be a little more lighthearted. A couple things we're going to talk about before baby comes, and then how to introduce baby on the day you come home from the hospital. So first, we are going to start with independent confinement. We want your dog to start practicing time away from the adults in the house while you're home before the child arrives. The hope is that your dog will find a place to relax. Maybe they're baby gated into the living room or a bedroom with a nice soft bed somewhere they can just hang out and be comfortable with you being in other parts of the house without showing signs of distress or frustration with not being to be with you at all times. That'll be important as the child's maybe crawling around the floor or on the move. If we need to safely separate the dogs, we can't have eyes on child and the dog at the same time, or there's safety concerns. It is never a bad practice to have the dog baby gated somewhere safe so you can focus on what the child's needs are, or if you and the child need to be working on something or feeding, bathing, whatever, then the dog's not completely underfoot and there's a risk for a bite or something like that. So start with that. Then we've got to get the dog used to all the noises that come with baby. Baby's gonna cry, there are gonna be different toys, rattles, nursery rhymes, stuffed animals that might play music, chairs that might swing, or things that might vibrate toy-wise that are gonna bounce around on the floor, pacifiers the dog may never have seen before. So we want to first work on all the different sounds. So if you have a friend or a family member with a child, you can ask them to record some audio of the baby crying and then send it to you so you can play it with your dog present at lower levels, and then increase the volume with practice in hopes that your dog is calm and quiet and maybe taking treats or eating food out of a Kong as the volume increases with repetition. If your dog is calm with the quiet crying and you progress and they're doing fine, then great, we are setting them up for when baby does arrive. Some dogs do know the difference between a recorded cry and a true in-person cry from a baby, but it's a good starting point. The other thing then is all the toys. Maybe before or after the shower, as soon as you start accumulating things, let's get those things out. Let's show them to the dog. Maybe if you do have a barrier or not, they can see the swing in motion. They can hear the nursery rhymes they're going to play from different toys or stuffed animals. Whatever you can do to get those things started so the dog is then listening to a baby crying, getting used to the sounds and different noises they're going to come with the toys. That would be a great second thing. Then we have all the gear that comes with baby. There's going to be a baby carrier, stroller, the crib, the pack and play, all those things that you might be have in your house that your dog may not have seen before. You could start by having your dog exposed to the pack and play, the stroller just parked in the living room or kitchen, just so they can see it and sniff it and just get used to it, and then start taking the stroller outside. Maybe you take your dog out to potty and the stroller goes with you and they get treats just with that stroller walking next. And also with the baby carrier, your neighbors are going to think you're crazy and think that the baby came super early, but you could start by carrying that empty baby carrier in and out of the house with your purse every day or groceries or whatever it may be, so your dog sees that as another object that you're just going to carry. Here comes mom with her purse and her lunch bag. Oh, and that thing that's a baby carrier. If they've never seen it before, and then it comes in with a screaming child, that might be more interesting, more stressful, another device, I've never seen that before. So it's better if they're like, yeah, I know what that is. Come on inside, you know? And then, so we've got confinement we're going to work on, noises we're going to work on, and then all the gear that come with baby. The last question is, how does your dog do when resting and maybe in bed at night if it sleeps with mom and dad? Some dogs will growl or show signs of aggression when touched in bed, when they're trying to move, if you're ever trying to move your dog off the bed, then we need to start practicing that dog sleeping either confined in a crate or baby gated somewhere safe, so that when the child is ready to be crawling into bed with mom or dad or waking mom and dad up at night, there's less opportunity, or there's no opportunity for the child to get bitten by that dog. So all these things we can practice ahead of time, so then we don't have a crisis of kids trying to get into bed, dog bites child, now we're trying to figure out what we do and how do we keep everybody safe and the family stressed. The more we can prepare earlier, the better. Same goes for any type of resource guarding. I mean, if the dog growls, shows their teeth, stiffens up over their food, like they don't want their food bowl taken, or a bone or chew, or even a stuffed animal, anything they see as valuable that they will guard, we need to come up with an action plan ahead of time so that a child does not have the opportunity to ever reach for those things. We try to caution about having children anywhere near the food bowl. The dog should be left at peace. Maybe an older child might be allowed to pour the food in, but then walk away and give plenty of feet space, not be in the face of the dog while they're trying to eat or reach in the food bowl. We don't want any of that. Same thing with chews and bones and toys. A lot of times I'll see children bitten if they're playing fetch with the dog outside. They reach for the stick and the dog doesn't want the stick to be released, and they bite the child, and then I get to see the patient then, and there's already a history of, well, he'd kind of guard it, or he'd kind of get stiff over top of it, kind of gave me the idea he didn't want me to take it, but most of the time he's okay, or he's never bitten before. If we have any hint of that, we want to come up with a safety action plan, and we can help you do that if you want to schedule an appointment. So those are just a couple things ahead of time to think about, and then baby arrives. Most times, dad or another adult is the primary caretaker of the dogs while mom's in the hospital. And the dogs may not have seen mom for a day or two. So the best thing is to give mom time one-on-one to see the dogs, greet them, hugs, kisses, tail wags, all those things that might happen when they're so excited to see her after a couple days. And then we have dad and baby coming in once the dogs are calm. Hopefully the baby is calm too. There's no crying, no signs of distress. So that way the dogs are relaxed. Dad and baby in the carrier come in and they're relaxed, and then the dogs are allowed to maybe sniff and approach if they feel comfortable, but we don't push them forward, we don't push the baby in their face, we just let them sniff and explore and think, what's that, If they're calm and relaxed, great. If the baby comes in and they're barking and overly aroused, hair is up, scruff, abandon ship, come back another time when everybody's relaxed. For some dogs that are higher energy, this might mean that they get a walk, jog, or run before dad and baby come in. For some families, this might mean we need 3 adults. We might need 1 adult to have the dog or dogs on leash, mom there between the dogs and kind of overseeing everything, and then dad and baby come in. But if you think there's any threat or concern, please give us a call so we can schedule a consultation. Dr. Arth and I are happy to talk to you, and if we think it's something that needs a veterinary behaviorist, we will let you know. Please keep in mind that we are so lucky to have veterinary behaviorists at Ohio State University. There are less than 80 in North America, so this is not a dog trainer. This is not a trainer that calls them a behaviorist. It is truly a veterinarian boarded in behavior, and that's a great resource early on if there are any potential signs for aggression, but if we can help you, we'll get you there too. So I hope you guys have enjoyed this video on some tips of introducing your dog and new baby. If there are any other topics you'd like to hear me discuss, please email us at info@libertypethospital.com. As always, you can call us for an appointment, and Dr. Arth and I would like to get you in. Okay, I hope you have a great day, and I'll talk to you soon.